Yeah, and our first trip down to the Children's Hospital of Philadelphia, they didn't mention the CAR T cell therapy. And then our second opinion when we went down, they mentioned it and said it wouldn't be ready in time for her. And I had talked to my wife, Kari, and said, you know, some people say they get a sign, but I see Emily getting better down there in the future in the bone marrow transplant hallway. And she's beat cancer, and we're teaching her to walk again. And I've seen it more than once, and I feel like some people get a sign, that's our sign. And then about a month later, that actually happened. And when we transferred down, you know, when they told us there's no more options available to treat Emily, I said, well, I'm going to page CHOP because I feel very strongly she's going to get better there. And they said, you know, the last email we read yesterday was the T cells got approved. Then they treated her and said, you know, Emily's not going to survive this cytokine release syndrome. I said, please keep trying to help her because I know she was going to survive this. And they took me in the hallway and said, there's a 1 in 1,000 chance your daughter's alive in the morning. And I said, I understand what you're saying, but please keep trying to help her. And the next day they tried the tocilizumab medicine, which saved her life. And on the last day in the pediatric intensive care unit, they transferred us back down to the bone marrow transplant hallway. We had to teach her to walk again, and she had beat her cancer. So I had posted at that time, I believe I'm witnessing a miracle, because how would I know that last month? So I felt we were guided.
Like I said, I always just remembered my parents were constantly there for me, and my dad would always try to make me smile every day. And currently, the only side effect that I have is I have to get B-cell replacement every 2 weeks. But that is really it. I'm just a normal teenager, and I'm pretty healthy.